Hello, it's Bonnie Southgate here from Pilates Therapy and the Core Inversion, and I am here today to talk to you about Syndesmosis Sprains. So we're looking at the interosseous membrane between the tibia and the fibula, and it usually occurs down at the distal end when somebody sprains their ankle with an inversion sprain, or it can be a rotational sprain. First one is going to be the cotton test, which was looked at in 2002 by Boomer et al. And has a sensitivity of only 25%. So I am going to have Maria give me her foot here. And basically the fibula and the tibia, we're going to take the two sides and we are going to give it a bit of a squeeze together. That in itself might give them a bit of discomfort or pain. And then I'm going to take her foot and I'm going to translate the hind foot laterally, which if she's got a sprain there is going to be quite painful, and we're going to know about it. If there is between 3 and 5 millimeters of translation or movement, that would be a positive test, or it was clonking, or she was in a great deal of pain. So that's the cotton test. The second test I'm going to show you today is called the Syndesmosis Squeeze test. And this was looked at by Caesar et al. And had a sensitivity of 30% and specificity of 94%. So a slightly better outcome with that screen in the research data. So I'm just going to have her bring her foot here, and what we're going to do on this, it's what it says on the tin, we're going to squeeze it. So we're going to take her tibia and her fibula and place the heel of our hands laterally on either side, and we're going to give her right from the proximal end of the bones a bit of a squeeze. If she had pain there, it would be a positive test. And then I'm going to move down, so I'm just looking at the different areas, basically bringing the interosseous membrane and the two bones together. If I squeeze up there, it's going to open at the bottom, so it would be painful if there was a sprain. So it's indicated that the more proximal the sensitivity is, so if you're pushing up here, the more severe the injury might be. So it would be more severe if they got pain up there than down there. In doing this, you would also need to be thinking about the possibility that that person might have fracture, contusion, or compartment syndrome. So you would want somebody who could rule all of those things out before you would be doing these tests. We are now going to look at our third screen for syndesmosis, which is for what we would call a high ankle sprain, or for a sprain of the syndesmosis in between the tibia and the fibula. And this screen had a sensitivity of 20% and specificity of 85% in an RCT done by the C et al. In 2011. So you need to get your client sitting, and their leg needs to be hanging at a 90-degree angle. You're going to take the foot into what they call plantigrade, which is basically a neutral foot that you would be standing on the ground with. And I'm going to fix her tibia and fibula with one hand, and then I am going to take her foot and take it into a lateral rotation, or an eversion type of position with the foot. And if there is pain or discomfort, then it would be positive for a syndesmosis sprain. Thank you for watching.